Doing great.
You're
feeling
looking
good.
amazing.
Thank you.
How was your day?
My day has been calm.
Nice.
Today was an off day, so
Yeah.
but the rest of the week has been a bit busy.
So
But today, good day.
When you say busy,
Yeah.
is it like you always getting clients back to back with what you do?
You know, if you've seen my social media, I do many things. So apart from
Right.
being a doctor, I own a travel business. I'm a content creator.
Nice.
So every other day there's something I'm
Yeah.
always doing.
Yeah, nice, nice.
And the different things that I do.
Okay, so first of all, tell folks what you do.
Yeah.
Obviously, you're an aesthetic doctor.
Yes.
But just go down to the detail and why you like doing what you do. And also tell folks about your podcast.
Oh, okay. So professionally, I'm an aesthetic doctor. So I'm a general doctor. That's a general practitioner. Then I went ahead and now specialized into aesthetic medicine. So, you know, most people hear aesthetic medicine, they're like, what's that?
Exactly.
So it's a new modern medical field, that deals with what we focus on is we want to treat patients' satisfaction when it comes to their looks. So it could be something in your looks that you were born with that you don't like, or something that happened along the way. You got an accident, you develop a skin disease, you gain weight, things that change your physical attributes over time, or something you were born with.
Right.
So our focus is to help improve the appearance of people and things that disturb them.
Help them stay youthful as well.
Yeah, and it also has the element of anti-aging. So it's quite a big field. It's not just about the skin and beauty. We have anti-aging. We have regenerative treatments, which mean we use your blood to also heal you and help heal inflammation and make you live longer. So it's quite a big field.
Yeah, you know, I feel like these days there's so much pressure to stay young, and look the part. You know, image is everything. That's what they say, right?
Yeah, true.
Yeah, so are Kenyans really big on, on aesthetics?
Okay, I think everybody has insecurities. I'm sure also there are things you're insecure about. Everybody has insecurities. But now when we come to the Kenyan demographic and aesthetics, Africa as a whole, this is a new field. The African cultures, and also as Africans, black don't crack, that phrase where we can look younger for long. But the thing is, black does crack. I'm sure there are friends around you you've noticed, you're like,
girl, let me
you're
tell
not
you,
looking like this.
When I check in my former high school mates, I'm like, guys have changed. It's almost as if I can't even recognize them.
Exactly. So we all age, but the issue is cultural differences. In the West, this treatment started years back. People have been taking them up.
Really?
Yes, these things have been done for years. Botox has been around since then. 1950s, 1940s, and it's evolved. How it's been used has changed. But in Africa now, aesthetic medicine is coming through. So to answer your question, yes, Kenyans are starting to partake. I can't say it's at a very high level, but aesthetic medicine starts even from simple skincare, facials. So on the simple treatments, beauticians you see doing them in the salons, there are aestheticians also do them. But when it comes to aesthetic medicine, now we're using needles, injections, now we are going more medical. So people there's still some fear beneath it. But the fact that it helps you not go to theater, it's an option to plastic surgery. That's making it becoming more open and open. People are becoming open to it. Okay,
so we're gonna get down to the detail in just a bit. But what inspired you to get into this space?
Wow, good question. I love beauty. I love beauty, and I love beauty. I love working with women. So those are the main.
So most
things.
of your clients are women.
Most of my in a beauty kind of
naturally.
Naturally it will be women, but men too. I don't mind working with men, but in my journey in medicine, I used to focus a lot on women's health. So I thought I'd do obs-gyna, that is obstetrics and gynecology, working pregnant women and delivering women. That's what I wanted to do. At some point, I wanted to do plastic surgery because I was like, okay, I also would like to improve people's confidence. So aesthetic medicine for me merges all these different things that I do. With aesthetic medicine, I can help change your look, improve your appearance, but you're not going into surgery. And in aesthetic medicine, again, I'm working with so many women. I'm helping many women rediscover themselves, improve their confidence, their mental health. So for me, it merged the different specialties I wanted to do, but something I can do in a shorter time and give me more satisfaction, because with my work-life balance, I do so much. So I couldn't get into very heavy specialty. With plastic surgery, dermatology, you go back to school for like around 5 years again.
Yeah.
At this point, I don't have that time. Maybe I'll do it later. But at this point, I wanted something I wanted to improve my skills, not just be a normal doctor, to do something different.
Very important.
But I went skill-based, yeah. So I trained on the skill of aesthetic medicine.
Yeah, so what's the difference between traditional cosmetic surgery and dermatology? Because I know there's like a thin line, isn't it? Yeah.
Yeah, so there's a thin line between plastic surgery, dermatology, aesthetic medicine.
Correct, yeah.
Yes, so traditionally, aesthetic medicine used to be done by plastic surgeons and dermatologists, because in part of their curriculum, aesthetic medicine was part of it. But for them, it's, you see the way you can have a course, then you just have a unit. For them, aesthetic medicine is a unit in their bigger trainings. Aesthetic medicine now came in where doctors can now, after you finished your med school, you've worked for a bit, you can now enter into it directly.
Right.
Yes, so that's aesthetic medicine. The difference is in aesthetic medicine, we're using minimally invasive procedures or non-invasive procedures, meaning it's not surgery. So let's say you have wrinkles. Plastic surgeon can do for you a facelift. You'll need to be under anesthesia. Your facelift will last 2 years, 5 years, longer years, yeah? The difference with us aesthetic doctors, you won't go into surgery. So we're giving you a minimally invasive option. So we can use Botox, we can use fillers, we can use microneedling, different ways to improve your appearance. But in aesthetic medicine, what it means is you'll have to come for another session.
So how long does it last before you come for another session?
Like, for example, Botox will typically last, different people's bodies will break it down differently.
I would imagine,
Yeah, but typically 4 to 6 months.
Oh, okay.
So you can, in your treatment plan with your doctor, you can be having maybe 2 sessions of Botox a year. And that will be enough for you.
Yeah.
But for plastic surgery, once you do the facelift and it's okay, it will be permanent. But again, you'll still need these add-on treatments to maintain that treatment, you know.
So for Botox, it's like, if you don't go after like 6 months, guys are like, now you're going back to that original Kev that I know.
You'll start noticing your
aging.
wrinkles again.
That's interesting.
But again, we do a lot of treatments, because with the Botox, I can also combine it with maybe a treatment like chemical pills. So even though you won't come for another Botox injection in a few months, there are other treatments and also medical grade skincare that can maintain your Botox to also last a bit longer. But once it's gone, it's gone. So that's why I always say Botox is not dangerous. People think it's injected into your skin, goes to your blood, does what? It just affects the muscle, helps the muscle relax for a few minutes. Because as we're having these conversations before, wrinkles come from talking.
I found that so interesting. So the reason most guys have wrinkles, even when they're not as old, is because, a lot of muscle movements on their faces.
Yes. One of the reasons, So we want to relax it. So when you're smiling or when you're angry, you're not making the lines. Because the thing is, at this point, like me and you, when I look at you, I don't see your wrinkles.
Thank God.
But when you make a movement, when you smile or what, I can see some lines. No, but now the thing is, it changes. Now that's called dynamic wrinkles. But with time, if you don't take care of it, if you're not protecting yourself from the sun, they now become static. You don't need to talk. I'll be able to just see all the lines in your face.
So my thing is this. These days on social media, when I'm just cruising the internet, I have noticed there's a bunch of guys, especially dudes, where we go to all these clinics and they do like the hair transplant, like the Botox thing going on. Now, is that a sign that probably Kenyans are just trying to look young, and or maybe it's a lack of confidence? What's going on in their psyche?
I'd say,
because it never used to be the case, especially when you're talking about our folks.
Yes.
But right now in this modern age, right, everyone is trying to do all these things and enhance the image and the appearance. So what do you think is the main reason behind all these enhancements at the core of it all?
At the core of it all, I think beauty, I'm not saying this as a vain thing, beauty sells. There's a correlation between how you look and even like success. I'm not saying people who don't look beautiful are not successful, but we live in there's a research that was done to show how people get opportunities. Someone who just comes looking up to get, well put together, you look like you're taking care of yourself, versus someone else. The person who looks well put together might have a higher chance of even getting a job.
That's
so
crazy.
I think number one is the beauty standards that have been put now.
Right.
When you're in social media, TV, you're in journalism.
You know what I mean? Yeah.
When you're looking for a reporter, you have to get the pretty one. So I think beauty standards, together with just people realizing that if I look better, I can also get better opportunities. But in the core of it, it's self-confidence.
I mean, I totally agree. Even in business, people somehow are attracted to the businesses that have like better salespeople. In the front desk, you will find that attractive person. Let me ask you a personal question. Have you done aesthetics on yourself?
I'd say through chemical pills.
Okay.
That's just the simple ones. But will I do injectables in future? Yes, definitely.
100%.
Yeah, because when I need it, I'll use them.
And besides, you own the clinic anyway.
just there with my mirror. And but of course, there's a reason for everything. Also, a good doctor is a doctor who will give you a treatment that you need. Not a doctor who wants to take cash from you and do treatments that you don't need. But what I was saying about self-confidence is beauty and mental health go hand in hand.
I was going to ask you, so how have you seen that play out for your clients in the sense, the before and after, basically? So this whole confidence thing, let's say you've worked on somebody before that, they're kind of like, Daktari, I was thinking, can you just do something with my eyes? And I feel like I have too many, like I have big eye bags. And then when you've done the process on them, now they're all bright. How, explain to me that process and how do you feel when you see all those changes,
I see it mostly, I'll go to the most basic, acne. Acne is a very big issue. It affects everyone in every age, from the young, teenagehood. There's also adult onset, and it leaves very bad marks on the skin. So people come and they're very low confidence. I have to have makeup every day. I can't leave the house without makeup. Yes, girls will love makeup, but the process of it is not easy. So for someone to be doing it every day, it's not an easy thing for them. So you go through the process. And something I normally say in dermatology, aesthetic medicine, patience is key. We are not a quick fix. It's not something that you'll wake up tomorrow and you see a difference. So you'll notice through the journey, they'll have a bit of apprehension. Why is it not working as quickly? Because sometimes even in our treatments, you might look worse before you look better. So there's also that part of it where they're still not sure. But then when they start seeing it, everything changes. They're like, now I walk around better. I don't use makeup. People suffering with sweating. People who, when you shake their hands, are just wet, but they're always sweating, so they have body odor. Botox is also used to treat that disease.
Really?
Which you call hyperhidrosis. You have excess sweating. Your sweat glands are hyperactive. Those are the ones who have seen being affected so much with confidence, because anywhere you go, someone will have the smell.
Wow. So give me an example of an extreme situation where, let's say you let me see. Maybe you had to work on a kid. Have you ever done that?
On a kid?
Because I know there's some toys out there who, especially baby girls. She just doesn't have confidence. In school, she's always made fun of. You know what I mean? Or maybe an older person and they're in denial that they're aging. Talk about an experience of either.
So young, of course. But it will be mostly for cosmetic dermatology. So you want to change something, but there's a medical disease behind it. So acne, eczema, that affects really young people. So the youngest I've treated is 12 years old.
Wow.
Yes. Very supportive parents. It's good to have supportive parents who listen to their kids. Because when their parents come, the first thing is, it's not even the acne.
Were they black?
They're black. That's why I love practicing here, because I can be able to interact with people of my skin color. And their parents, the first thing will be, they don't have confidence at all. They're always wearing a hoodie, to hide their face. In class, they're not confident to answer questions, because it also affects even their learning. And that's how it affects your mental health. They're not confident in class. They don't have friends. They stay alone. But once their acne gets better, you find they become more sociable, and their mental well-being is even better. For an older case, this was a lady who was bleaching initially during her younger years, then she stopped. So you were bleaching, your skin was dependent on this thing, then you stop, and she was not using high grade quality. It's the much warm things. So there's this thing called onychrisis, where you just get black.
Oh. And
her confidence was really low.
Yeah.
She couldn't go pick her kids from school.
Nah.
Because you can't interact with other parents. And as I say this consent has been given to share this story. Yeah, we can't share patient's story without consent.
It's true. So she's given the consent.
Yeah,
Good
consent
stuff.
has been given.
Yeah.
And she couldn't take her kids to school. She stopped going to church. Even at work, she's avoiding work. And now, for her, it will be a very long process, very long. But the more we work together, she's more confident now. She feels like her face looks even a bit brighter, even though the marks are there. She can have a bit more confidence to even go back outside. So I think appearance and mental health is
they go hand in hand.
Yeah, very hand in hand in both ways.
Nairobi, man. Nairobi is crazy. All right, so hold it right there. Guys, we're talking to the one and only Dr. Diana Justus. She's an aesthetic doctor and a podcaster. It's all about beauty, confidence, and mental wellness. We're coming back right after Foxy Brown and Drew Hill. Big Bad Mama. It's 20 minutes to 8. 20 cars.
Online, mobile, and on radio. Facebook at SpiceFM KE.